Dobar dan svima, ja sam dr. Milorad Stamenović i nažalost nisam u mogućnosti da prisustvujem na konferenciji, tako da kolege su me zamolile da pošaljem video zapis prezentacije, što ja sada i radim. Kako je radni jezik konferencije, pošto je internacionalno engleski, ja ću svoju prezentaciju uraditi na engleskom jeziku. So today's topic is advancing environmental sustainability through patient-centric digital health solutions across Europe. Let's start. About this research. So in this research, I have been dealing with digitalization and green economy intersection. So I wanted to add some contribution in terms of the healthcare systems. This is the area where which I'm dealing for many years now, and I'm specialized in healthcare management, health economics, and so on. So basically, I wanted just to check what is the current situation of healthcare system digitalization in Europe. Basically, I wanted to do some comparison also with Serbia. So how we are doing things in the Republic of Serbia, and to give some inputs about where we could go in future. So importantly, reducing carbon footprint is something that is heavily connected with healthcare digitalization, especially when it comes to the use of telemedicine, about the consumptions and so on. How does patient-centric sustainability and overall how patient centricity came to this scope? Basically, you can't work effectively in healthcare without empowering your patients. Empowerment of patients could be done on individual level, or it could be done on more systematic level, I would say. So patients have to accept and usage of any new solutions, and they need, so there is a certain level of education that is necessary to be provided to the patient, so we can follow some good practices from around the globe about how this could be done. But very important thing is patient empowerment and moving forward patient engagement, and then moving forward patient centricity. So if you are able to achieve this, as most of the new guidances are saying, in that case, all of your operational modifications will be much more successful. Yeah, so as I mentioned, so in this particular research, I was focusing on Europe. We did some exercise with the regression analysis just to see what is the level of impact of healthcare investment to the digital solutions, and we have implemented I think more than 15-16 different variables, and we will present those results later. Now, what is important message to be taken after this meeting is that obviously healthcare environmental impact is contributing to globally with about 4.6% of CO2 emissions. We think that by usage, of different solutions that will be presented here, this could be significantly reduced. In addition to this, during this research, but also before, it was noted that we are lacking actually efficient metrics in order to more precisely understand what is actually happening with CO2 emissions when it comes to healthcare. Healthcare system is the biggest state, each state subsystem. It employs hundreds of thousands of employees across the Europe, per each country basically, and it is very complex, meaning that another very important point is that entire country is gravitating to this system. So in Serbia, this is like 6 or up to 7 million people, but you could have like 80 million people, like in Germany, or almost 70 million people gravitating to healthcare system in order to solve some of their problems, or even to resolve some of the administrative things. And then when you count on all of those things, basically, then you can really understand how many travels are done in such cases, and what is basically the impact to environmental impact. And then, of course, there are some other things like material waste and some other things that definitely could be reduced when it comes to the healthcare. So for this research, I was using a WHO digital health implementation across Europe monograph. So they have collected certain number of data. This was a research done for 52 countries in Europe, including Serbia, and it is a relevant source of information. I will just quickly run through this slide. Basically, digital health for environmental sustainability is something that we want to achieve moving forward. So regulators are moving in this direction. Healthcare systems are also moving in this direction. We will see the level of the current status. We will see what could be improved, right? The use of blockchain is also something that is very helpful, especially when it comes to supply chains and enable ethical sourcing and real-time environmental impact tracking. On the other hand, telemedicine is definitely one of the main things that could help. Telemedicine again could be diversified in several different sectors. We will see this later on. Patient driven impacts which are connected to the carbon savings in numbers. So this is something that is already done in certain countries in Europe. Yeah, I mean, we need the better data, right? So the better data we have, we will be able more to influence within research, within managerial implications, and so on. Literature review. So I have presented here some of the ideas about the literature review and where we see the problems. I have already mentioned some of those when it comes to the metrics. When it comes to the how to reduce CO2 submissions coming from a healthcare, and then it's very important to see where we are with the current situation. So on the European scope, but also we have noted that actually COVID pandemic significantly modified this field and actually improved the field because of the current necessity. I also wanted to show when it comes to the metrics. So many researchers are trying to point basically importance of the adequate metrics. So how we are going to measure certain things in the healthcare in order to better understand them and then to provide some solutions. So on this slide, you can see information about the virtual consultations, about the digital medical records, which are basically reducing need for in-person visits. You can see in a red face-to-face appointments, then you can see in green digital appointments, and then you can see CO2 emissions which are avoided. So this is very nice example that could showcase to us how we can actually reduce and how important is to move in this direction. It's not only about the CO2, which is super important, of course, but it is about a new age of communication, which is today available to everyone, and there is really no need to have additional burden, if there is no necessity for this. So on this slide, you can see digital transformation of healthcare in Europe. So this is a summary table of European countries' status on use of the digital health tools. I have selected telemedicine adoption in a percentage, e-prescription adoption, and EMR adoption. So you can see that Serbia is more or less struggling with this. Those numbers might not explain, because when it comes to EMR adoption, we do have adequate EMR using for many years already, but there are still a lot of challenges with the EMR system that we are using. On this graph, you can see which of the selected indicators. So I have collected main indicators in digital health technologies in Serbia. So, and as you can see, so telemedicine, telepsychiatry, telepathology are the areas which are basically, so we are not using, right? So they are not used in Serbia. So when it comes to teleradiology, there is a certain progress. Booking of medical appointments as well. So wherever you can see in blue, it means that we have this developed. Now the question is, to which extent is this developed, of course, and how do we see usage of the other segments which are not yet developed, and why those are not yet developed, and then we can connect this topic very nicely patients' empowerment and patient centricity. So how patients are familiar with those systems, whether they will be familiar with the new system that should be used, whether there is adequate communication with the patient, patients explaining why this is a better solution for them, why this is a better solution for environment, and so on and so forth. So honestly, I didn't saw that many efforts. I didn't saw this structural communication between the different patients organizations or overall patient population in Serbia. But still, I'm glad to see a certain progress comparing to the previous year. So it means that we are also advancing in terms of digital health technologies. For this paper, when it comes to methodology, so one part is certainly related to analytics, literature analytics. So I have mentioned already some sources of the major international organizations, and based on those sources, I have presented, some graphs before. But also we did one exercise when it comes to the health investment as a percentage of the GDP. So I was using this as a dependent variable. So I was confronting this together with the multiple different digital health variables, together with some basic information about the countries' CO2 emissions, as population and the GDP and so on. Overall, I have also provided here some explanations about certain variables, and when it comes to methodology, so obviously this was a quantitative exercise with multiple regression analysis that was employed in order to understand the strength and the significance of the correlations which were provided. Nothing special. This is a multiple linear regression model that was used for this analysis. And here you can see selected independent variables which are connected into one group, basically of the digital health tools. So you can see that positive. We had as a result positive coefficients, especially when it comes to National Digital Health Patient Portal and teledermatology, that were indicating that implementing this digital health solution is associated with a higher healthcare investment. So I mean, there is a nice logic that a higher investment in healthcare should provide better circumstances for development of the digital healthcare. But also, as you can see, we had a negative coefficients which are suggested a potential reduction in healthcare investment, possibly due to budget relocation or implementation challenges like public funding in digital health and telepsychiatry. This was something that is not so expected, and basically it is showing that there is the link between the investment itself and the development of the healthcare, digital healthcare might not be strictly clarified, but also it is affected basically by many different factors on the country level. We have to include also dynamics and the progressiveness of the country and those topics following on the international guidances and certain politics. When it comes to the impact of the digital health factors on healthcare investment as a percentage of GDP, so you can see regression coefficients on this slide basically, and when it comes to results, so higher digital health adoption are significantly associated with the variations in healthcare investment like telemedicine, e-prescriptions, and EMR. Then when it comes to efficiency and spending shifts, so digital health adoption leads to both efficiency improvements and challenges in spending patterns within healthcare systems. When speaking about the CO2 emission reduction, so critical indirect effect is the potential for CO2 emissions reduction through minimized patient travel and optimized workflows. Also, positive association between the telemedicine adoption and healthcare investment is suggesting that countries are investing in digital infrastructure more readily, integrating virtual healthcare, and then this is resulting in large reductions in CO2 due to this shift. Reductions of CO2 emission because of the telemedicine use are significant. So there are some ideas. It could lead to 2 to 4 kilograms of CO2 per patient in a case of even single teleconsultation. So this is something that, of course, should be further researched. But we do have a certain idea how what could be saved basically when it comes to CO2 consumption. Also, we know that digitalization contributes to sustainability by reducing deforestation and the carbon footprint of traditional prescription systems. So this is also something that is quite obvious. I will not speak too much about this slide. So I think we have already mentioned some of the main concepts and how actually we could contribute. But what is really important is policy. So if, for example, telemedicine is incentivized with the use of consultations, whether urban or rural, then the services will become more available. So policy is very important, and I would say adherence to the policy is in some cases even more important. How with this paper, how we are actually contributing to discussion on the healthcare system and reduction in CO2 emissions. So we have provided empirical evidence of the relationship between digital health adoption and healthcare investments as a percentage of the GDP across Europe. So we are providing analysis on areas to focus within the digital health realm and also about the carbon footprint. And in addition, we are contributing to a limited body of research which is quantitatively examining the environmental impact of digital health strategies at a macro level. And we are also seeing, where we are at the moment, especially when it comes to European development of the healthcare digital solutions when it comes, to each of the European countries. In addition to this, here you can see a certain, I would say, more like managerial implications. So I think that in this paper we will provide data-driven justification for healthcare managers, but also policy makers and everyone who is interested in digital healthcare. That basically we need to see how far we can contribute to the healthcare digitalization in Europe, more specifically in Serbia. We need to see how we can work, more when it comes to the patient organizations, overall patient engagement, patient centricity, and connections with the implementation of the digital health. We also are highlighting the potential for healthcare organizations to contribute to reduction of CO2 within a different teleconsultations and so on. And so importance of engaging patient in the digital health transformation is very important. So, and this is what at least I do not see to the sufficient extent, especially in the Republic of Serbia. To conclude, digital health investments improve healthcare access and efficiency by reducing CO2 emissions. So 3 to 5% could be some numbers that we can use. Scaling telemedicine to 80% adoption is something that is a goal which is reachable in the following period. Using green energy and energy sufficient blockchain will certainly support the supply chain processes, and then implementing various digital health methods is something that is important, and that is a future of healthcare systems. While from the other side, probably not sufficiently explored, not implemented in practices, patient engagement and patients' education in the processes, especially in certain areas where this is more important, depending on the demographics of the population. And so affordable data centers and assisting to underserved communities. This is also one of the conclusions. Thank you very much. Once again, I apologize for not being able to join you face to face. Hopefully next year we will have this opportunity. I would really like to meet you in person and speak about this or other connected topics with you. Once again, thank you very much, and enjoy the rest of the conference. Thank you. Bye.